Good afternoon, everyone. I want to start by thanking Arizonans around our state for being so responsible over the Thanksgiving Day weekend. I hope everybody had a happy and safe Thanksgiving. From what I saw in the news and social media, everyone did a great job adhering to the public health guidance, and I'm proud of Arizonans once again as a model for the rest of the nation about personal responsibility. Now, we're going to start out today with an update from Dr. Cara on where we are with COVID-19, and then we have some announcements for you. Dr. Christ.
Thank you, Governor. I wanted to provide an update on the trends our public health experts are seeing in Arizona and some of the steps that we have taken in enforcement of the mitigation strategies. So we remain highly concerned about increases in key metrics used to monitor COVID-19 transmission, cases, percent positivity, and COVID-19 patients in ICU and inpatient beds. To date, a total of 340,979 cases have been reported to public health, and we've lost 6,739 Arizonans to COVID-19. Last week, the week of November 22nd, the percent positivity was 15%, and this week we're trending higher. The COVID-like illness metric is also trending upwards, indicating increased visits to emergency rooms and admission to the hospital for COVID-19. And hospitals continue to see increased demand and increased usage of inpatient and ICU beds. My team is working with public health, hospital officials, and through public education to address this at all angles, including enforcement of the mitigation strategies we established during our summer surge of cases that are still in place. ADHS developed mitigation requirements that restaurants, gyms, movie theaters, water parks, and others need to implement, such as masks, physical distancing, and other COVID-19 mitigation strategies. And these requirements are being enforced at the state level. As of today, we have received just over 2,800 unique complaints about establishments. Of those unique complaints, over 90% have been addressed and closed, and over 600 on-site investigations have been completed. And we have provided over 2,000 establishments with technical assistance and education. But we encourage everyone to be part of the solution. If you see an establishment not requiring the COVID-19 mitigation requirements, please let us know through the COVID-19 compliance hotline or online at azhealth.gov/compliance-COVID-19. And as a reminder, there are simple steps that everyone can take to reduce the risk of COVID-19. Wear a mask indoors and outdoors anytime you will be around other people who do not live in your household. Reduce the size of your gatherings. Stay physically distanced from those you don't live with, and wash your hands frequently. We share everyone's excitement with a COVID-19 vaccine now within sight, but we have a long way to go. So until then, it's critical that each of us take steps that are proven to reduce the spread and protect our most vulnerable. So thank you.
Thanks so much, Dr. Christ. I want to reemphasize what Director Christ said. The numbers in Arizona are heading in the wrong direction. COVID-19 cases are on the rise in the state of Arizona, and they are rising around the nation. That's why today we're unveiling new measures to mitigate the spread and protect our healthcare system. I want to begin with our hospitals. I had a call yesterday with the leaders of our state's largest hospitals, and they were very candid. They told me hospitals throughout the nation are overwhelmed and staffing resources are spread thin. A couple weeks ago, we announced an investment of $25 million into our hospitals in order to strengthen staffing for our frontline healthcare workers. We are already seeing the impacts with 300 additional healthcare workers coming into the state of Arizona. When we made that announcement, someone, I think in this room here, asked me, is $25 million enough? My commitment then was, we'll do whatever is necessary. And today, we are doing more. With the announcement of an additional $60 million investment in hospital staffing for a total of $85 million. This significant investment will allow us to provide an additional 500 nurses through the end of the month, with additional staffing to last through January. It will ensure our hospitals can care for those who need it, and that the existing staff in our hospitals are properly compensated for their dedication and commitment. We don't want to see anyone admitted to the hospital. We want every Arizonan to behave safely so that they never need these resources. That's why restaurant capacity is limited. Theater capacity is limited. Capacity in our gyms is limited. Masks are required in all of these settings. Local jurisdictions across the state have implemented mask mandates. In fact, independent sources have Arizona's mask usage rate at 91%, higher than states with a statewide state mandate. That's a tribute to Arizona citizens and local leadership. And last week, Graham County became the latest county to implement a countywide mask mandate. Some have called for additional mitigation measures, shutdowns of entire industries, and curfews on our citizens. I believe we should instead focus on accountability and enforcing the rules we have in place now, and taking a targeted approach to ensure we all participate in the safety precautions we know work. When it comes to mitigation, I know we've asked a lot of Arizonans these past 10 months, and I'm grateful for everyone's commitment and perseverance in slowing the spread of this virus. Life as we know it has changed. You see it all around, how differently businesses, schools, universities, and all public settings are. There's almost nowhere you can go in the state of Arizona and no part of our economy that you can participate in without wearing a mask. From the beginning of this pandemic, one of our main goals has been to limit large gatherings. Over the summer, we prohibited gatherings of over 50 people unless first approved by a local jurisdiction. We believe they are best equipped to make these decisions about events. But they shouldn't just be a rubber stamp. We want to make sure that there's a plan for hosting events with mitigation measures and adherence to public health guidelines. Masks, distancing, common sense measures we know work. So today, I'm signing a new executive order putting more teeth and transparency around these larger events. Under this order, when a public event greater than 50 people is approved, the local jurisdiction must publicly announce the event and post details of the enhanced mitigation strategies on their website. This should include an agreement by the hosts that they will implement these mitigation strategies and that they will be enforced by the organizers and local law enforcement. We don't believe that every event should have to get approved through the governor's office. We want to make sure that it can happen at the local level. And these measures will help ensure events that do happen safely with accountability. Also, Dr. Christ is providing revised enforcement policies from the Department of Health Services for all businesses. If 2 substantiated complaints are received of a business ignoring the public health guidelines, that business will first face a warning and the ability to come into compliance. On the second substantiated complaint, they will face closure. Our businesses have done a great job, and it's not right and it's not fair to those that are playing by the rules for others to openly ignore them. The outliers are few and far between, but we need fairness and an even playing field. Next, slowing the spread of COVID-19 while supporting our businesses and their ability to operate safely. Since the middle of May, we've been fortunate to keep most of our establishments open, and our businesses have been phenomenal, operating at partial capacity, implementing enhanced sanitation, requiring masks. It is because of the responsibility of these establishments that they've been able to remain open. So thank you. Public health experts have found that dining outdoors is safer than dining indoors. That's why we've limited indoor capacity and encouraged outdoor dining. And in Arizona, we have the luxury of a beautiful winter that lends itself well to grabbing a table outdoors in so many parts of our state. But transforming operations for our restaurants isn't easy, and it certainly isn't cheap, especially during a pandemic that's been a challenge of a lifetime for our local and small businesses. That's why today I'm issuing an executive order that will allow restaurants to extend their premises past sidewalks and other public rights of way, cutting red tape. This allows our local restaurants to expand outdoor dining and create additional space for people to dine out safely while still following all the health and safety requirements. And to help them out, we're investing $1 million in partnership with the Arizona Restaurant Association to help small Arizona-owned and operated businesses buy heaters, barriers, outdoor furniture, and other supplies in order to move operations outside. I'd now like to introduce Maricopa County Supervisor Steve Chukri, head of the Arizona Restaurant Association, to talk more about this partnership and the work of his members. Steve?
Thank you, Governor. Thank you, Governor Ducey. I also want to make sure I thank your team, the Arizona Office of Tourism, and everything you've done for the restaurant industry in these past 9 months. I always believe that numbers tell a story best. So I'm going to start with that. Arizona restaurants posted sales last year of $13.4 billion. We were slated to go above $14 billion this year. We employ 230,000 people in the state of Arizona in the hospitality industry. That's directly in the restaurant industry. And we're very proud of that. Sadly, I will tell you, since COVID-19 hit, we've lost over $2 billion. Early on, as the governor said, before we had to take some drastic measures, we had to furlough or lay off 80% of our workforce, displaced workers. Think about that for a minute. Our daily payroll went from $14 million per day to $2 million. We're slowly recovering. I'm pleased to tell you that those numbers are getting far better, and it's because of the measures we have taken. We are at 50% occupancy, as the governor has said. It seems to be working well. Our takeout is doing much better. But make no mistake that the restaurant industry certainly understands the need for good sanitation. Just a few years ago, the restaurant industry across America became the most trusted industry in America. And I say with that opportunity comes responsibility. So the measures we have taken by screening our staff members before they come to work, taking their temperature, making sure that we've got barriers inside our dining room and out, ensuring that our handles and protocols of strict cleaning measures across the restaurant take place, introducing technology like smartphones and apps that will now make reservations instead of people congregating in our dining rooms and in our waiting areas. We're doing all that we can. We're the cornerstone of our community. We want to certainly continue to be that cornerstone. With what Governor Ducey has mentioned today, as we move forward, is going to be very helpful to the restaurant industry, especially by being able to utilize outdoor space and these parking lots and other measures that this funding will allow us to do, and also to continue to be the great hospitality industry that we've always known to be here in Arizona. Thank you, Governor.
Thanks so much, Supervisor, and I really appreciate your continued leadership and partnership. Many cities and towns have been doing tremendous work to help small businesses, especially restaurants. I'd like to introduce Mayor Tom Murphy of Sahuarita to share about the great work he and his team have been doing in Arizona. Mayor?
Thank you, Governor. It's an honor to be with you today. I can confidently say that this year has certainly been a unique challenge for Sahuarita, as it's been for everybody else. COVID-19 has threatened the health of our local economy as much as the physical health of our residents. We've been doing our very best to improvise, adapt, and overcome. On behalf of the town, we especially want to thank you, Governor, for the Arizona CARES funding that was provided to help offset the public safety, relief, and freed up resources for much needed other programs, such as what we implemented in the town of Sahuarita, our Business Safety and Recovery Program. So far, the program has awarded $440,000 to 43 different local businesses. Sahuarita's small businesses, and especially bars and restaurants, have been hard hit by the economic impacts of the pandemic. More than a third of our businesses awarded this financial help came through this business recovery program, were locally owned, non-franchised restaurants. In May, I took the action to use our emergency declaration to relax building codes in order to allow local businesses to creatively address questions of seating capacity so that restaurants could create safer spaces for patrons, including temporary outdoor dining. We have continued to relax these restrictions, as well as our sign code, to allow our business flexibility in their solutions. Our economic development staff has spent countless hours offering a personal touch to individual business owners, encouraging and assisting their applications for aid. Our communications team was quick to go live with a COVID-19 update on our town's webpage, with a section dedicated to helping businesses navigate options for financial assistance. We've also established a number of smaller programs aimed at amplifying the call to shop and dine locally. Throughout the pandemic, we took to social media with a Takeout Thursday campaign featuring different local restaurants each week. We partnered with the Green Valley Sahuarita Chamber of Commerce marketing Restaurant Week, including media releases, print banners, and web pages promoting our local restaurants to our residents, while highlighting the promotions and health precautions being taken by these restaurants. Over the summer, we used Shout Out Wednesday campaign to highlight the importance of shopping locally, continuing to support our local residents and restaurants during the pandemic. Currently, we're in the midst of Tis the Season to Shop campaign, encouraging residents to shop locally during this holiday season. We want to thank the governor and staff for all of the support over this time. And please remember, during this holiday season, we still have many families that are struggling. Please, if you're able, contribute to your local food bank, drop some money in your local Salvation Army Red Kettle Drive, or another charity of your choice. It will help your fellow neighbor. Thank you, Governor.
Thank you, Mayor. Thanks so much, Mayor, and thank you for making the trip up to the state capitol, and what a great example of a public-private partnership and the creativity and support that's possible there. You and your residents have done above and beyond during the pandemic, and I appreciate you being a leader in the community. Now let's talk about vaccines. A couple weeks ago, we learned that both Pfizer and Moderna have developed promising vaccines that report 95% effectiveness in late-stage trials. This is incredible news. Dr. Christ and her vaccine task force are working around the clock to guarantee an efficient distribution of a vaccine once it is approved and available. We expect Arizona to receive doses of the COVID-19 vaccine in mid to late December. Yesterday, I visited with leaders of insurance companies across the state. We agreed that the vaccine should be free for anyone who needs it. This is a global pandemic, and the vaccine shouldn't cost Arizonans a penny. Today, I'm issuing an executive order in cooperation with our insurers and our healthcare providers that ensures every Arizonan can get a vaccine free of charge. Later this week, Dr. Christ will be rolling out our full vaccination plan. And there's one element I want to highlight today. I've asked her to prioritize teachers as among the first individuals in the state who will receive the vaccine. We want our schools open and our teachers protected. We know that teachers desperately want to get back into their classrooms safely. Teachers are essential to our state, so under our plan, they will be prioritized, along with our frontline healthcare workers, doctors, nurses, hospital staff, long-term care, of course, our most vulnerable, and critical law enforcement officers. Next, I want you to hear from General McGuire, who's led our National Guard throughout this process and remains focused on the fight against COVID-19. General.
Thank you, Governor, and good afternoon. I just want to give a quick update. First, since we last met, we continue to have about 730 of our great Arizona men and women who serve in the National Guard on duty in response to COVID-19. I want to thank Governor Ducey for making a formal request to the President and the administration for extending that mission, which currently lapses on December 31st. We've made an extension request for up to 750 Guardsmen through March 31st of 2021. Hopefully we'll have resolution on that in the next week. Assuming that mission is extended, we'll continue to stay laser focused on what we have been doing, primarily our medical task force, which today is serving 5 testing sites that are seeing a surge in requests, the biggest one being at Fort McDowell, Yavapai, and our tribal communities, and as well as the logistics team, which is serving 46 food banks today. To a point of reference, I'll let you know that our Guardsmen have driven 775,000 miles since March in support of this mission. And as the vaccine arrives, Dr. Christ and the county health officials have done just a great job of developing a plan for distribution. But as we filled the gap last time, if there are any gaps in the rural areas for that last mile, our logistics team will cover that as well. So I just want you all to know, remain confident. I'm absolutely certain that the vaccine will arrive here in the next 14 to 21 days. And if there are any gaps and seams in our plan, the Guard will step in to make sure that all the rural areas are covered. So thank you very much, Governor, for the time and continuing to serve.
Thank you, General, and thanks for all the good work from the members of the National Guard. Very grateful. I want to reiterate that we continue to need the support of the public in all of these efforts. Please continue to follow the health guidelines. Wear a mask, wash your hands, physically distance yourself, and stay home if you're feeling sick. I've said it every week and I'll say it again. These are small steps that make a significant difference in slowing the spread of this virus and protecting our fellow citizens. Finally, I'd like to close by giving my most sincere condolences to the families who have lost a loved one due to COVID-19. We grieve every death in Arizona and want to continue to do everything we can to contain the spread of this virus and protect lives. Our hearts are with you, especially during the Christmas and holiday season. So continue to mask up and follow all the public health guidance. And with that, we'll open it up for questions. CJ?
Let's begin with Stephanie at the Republicans.
Thank you, Governor and Dr. Chris. Yesterday, a group of hospital leaders sent a letter to Dr. Chris asking for urgent actions, including a statewide curfew, an end to athletic events, and an end to indoor dining. Do the announcements today mean that's not going to happen, or are you still considering those things?
Thank you, Stephanie. The announcements today are the steps that we're taking at this time to slow the spread of the virus. I mean, of course, we're listening to all the leaders in our community. We spoke with the leaders of the insurance industry yesterday, along with leaders of all of our state's largest hospitals. So we take all of the input. I'm with Dr. Christ nearly every day, and of course the input and guidance of the White House Coronavirus Task Force as well. And the steps that you're hearing today are the steps that we're taking to continue to slow the spread of COVID-19 in the state of Arizona.
Thank you.
Dennis.
Thank you, Governor. First of all, I just kind of want you, if you walk me through, or walk us through this again, how any of these plans here actually do mitigate the spread. It seems like, you're encouraging people now to go out to restaurants. And you're also just saying, like, look, all we're going to do to try to limit large gatherings is make them post this publicly. This doesn't seem like it does anything to mitigate the spread.
Well, I would challenge back and say that what we're putting forward here is exactly what we did when we were at our time of maximum challenge in the state of Arizona, if you remember, in the last 2 weeks of June and the first 2 weeks of July. We for a period of time, had targeted direct actions on restaurants, on gymnasiums, on movie theaters and water parks. That's where we went from, I think at the time, the highest critical case count in the country to where for a period of time we've been in a much different situation. And as I said 2 weeks ago, we never held a press conference and said, we're lifting all of these measures because we're out of the woods. What we did was adjusted those measures. And we're going to continue to adjust those measures so that people can safely operate inside our communities so that we can protect lives and make sure that people are in the safest possible position when they are participating in our economy.
Carly from KOLD.
Thank you, Governor. Last night, Tucson City Council passed their mandatory curfew that's going to go into effect here on Friday. What's your kind of reaction to that, the legality of that, if you plan to fight it, and also if you plan to touch bases with Mayor Romero? I know she mentioned a couple days ago she hasn't spoken with you since March. And also, any clues to maybe doing a statewide curfew? Look for that as well.
So I disagree with the policy. I don't think it's the right approach. If Mayor Romero wants to talk, she knows where to find me, and every time she's reached out, she gets a call back. But we want to do things that will allow businesses to continue to operate safely. We believe that if we will continue the mitigation steps that we've laid out, and there will be enforcement around those mitigation steps, those would be the best things that we could do to continue to slow the spread. I don't know how the mayor intends to enforce the curfew when she won't enforce the steps that are already in place.
Governor, I appreciate what you're saying about, we've got this stuff in place that we did in July. We actually hit a higher peak on November 23rd, even when you discount the bulk stuff. We actually hit a higher peak than we did in July. So it suggests that whatever is happening now is not working. And all I hear you doing is saying, we're going to do some group things, we're going to throw some money at Steve Chupri's friends here, and somehow that's going to solve the problem. Tell me how that keeps people safe. You talk about, we mourn every death, we want to do everything we can to prevent people from dying. I don't hear it here.
Well, we know a lot more today, Howie, than we did back in June or July. Our healthcare providers have gotten so much better at treating the disease, at keeping people alive. Of course, these hospitals are stressed and strained, and that's why the $85 million investment in additional staff. But the steps that we have laid out today and extended are the same steps that got us out of the time of maximum challenge in the summer, and we're going to continue to stay focused on those.
What you're basically saying is as long as we've got hospitals that can treat the disease, we're not going to deal with preventing people from getting sick in the first
That's
place.
Howie. That's not what I said. We would like people to prevent getting sick, and the best way to prevent getting sick is to wear a mask, to socially distance, and to wash your hands. That's CDC guidelines.
And the CDC and the White House task force on the report of the 22nd, the White House, these people you say you're following, said Arizona needs to go back to summer mitigation measures.
And we're listening to the White House. We've limited capacity and we've expanded the footprint that allows people to further socially distance safely.
Let's go to Cameron next.
Afternoon, Governor.
Hi, Cameron.
I'm hoping to talk to you a little bit about vaccines today. That's obviously what a lot of Arizonans have on their minds.
Mhm.
It's the light at the end of the tunnel right now. When it comes to supply, can you expand on what the supply will look like here in Arizona and how often that will be replenished? And can you also talk to us a little bit about why educators were added? And not only that, but how will educators be vaccinated? Obviously, there's a plan in place for hospital workers, and most of those hospitals will vaccinate their own employees. How will our educators be vaccinated?
So great questions. And yes, vaccinations are something that we're very optimistic about. And I want to differentiate because there's a difference from vaccines to vaccinations. This is an incredible logistical undertaking. And we are going to start with our people that are on the front line, the doctors, nurses, hospital staff, most vulnerable, long-term care, congregate setting, Native American communities, and most vulnerable. But from there, we will be moving to essential workers. And among the most essential workers in the state of Arizona are our teachers. So we're going to see with the coronavirus task force, with the work of Pfizer and Moderna, we have an expectation of vaccinations or vaccines that are coming our way. We're going to be working with both healthcare providers, urgent care providers, pharmacies, and convenient locations around the state. And Dr. Christ has led the vaccine task force that has put this together. And it was a conversation that I had last week with the vice president on our latitude for vaccinating teachers. And he said that is 100% up to you and your team. And that's something that we've entered into the discussion. So I want Dr. Chris to give you more of an overview of the plan for rollout once we receive these vaccines and what the expectation is on December 15th and then in the weeks following. Doctor?
We anticipate getting vaccine starting mid-December, and what it will likely be is a weekly allocation that Arizona gets. So as the manufacturers are able to produce the vaccine, they will be sending it out on allocation to each state based on the population. We'll be working with our county health departments to get that out. So just like you said, that first priority group, those healthcare workers in long-term care facilities, we will be working with the healthcare systems to ensure they can get their employees vaccinated. We will also be setting up sites, though, for they may be industry specific as we get into those essential workers. So there will be locations where either people can go, or if the business is big enough, we may go to them and vaccinate them. But that is part of the plan, and we're enrolling vaccinators into that so that we can make sure that we're getting it out as wide and as far as we can.
Well, I got you. I still want to ask you, too. Storage of especially the Pfizer vaccine is extremely essential. If it drops, if it goes above that required storage temperature for even a small amount of time, it can seriously affect the efficacy rate of that vaccine. How will you transport these vaccines to more rural areas? How we get them to the Navajo Nation? Will the Arizona National Guard play a part in that? And what do you have set up to make sure that these vaccines never drop below that required temperature?
So the government is actually going to direct ship those the Pfizer vaccine, which requires the ultra cold storage, directly to the vaccinators. So it will go directly there in rechargeable storage containers that maintain the temperature. The Moderna vaccine only requires regular refrigeration or freezer space. So, and they'll be about a week or two behind. So those will likely be the vaccines that will be prioritized for the rural areas because they don't have such stringent temperature requirements.
How soon will you have a number on supply?
We believe that it's in the hundreds of thousands before the end of December.
So let's go to Billy from iHeartRadio, who also has a vaccine question.
Thank you, Governor. I'm just curious, there's a lot of rumors going around about this vaccine. There's talk of a vaccine passport, maybe corporations, companies, and governors like yourself mandating it in certain situations. Can you just tell the people of Arizona whether or not the vaccine could be mandated in any capacity?
Well, Billy, I agree with you that there's a lot of rumors going around, but what we want to do is make sure we're communicating the facts to the people of Arizona. And much like masks, we want to see the maximum level of compliance. These vaccinations are our road back to a normal life, a safe life where we are protected and our loved ones are protected, where our kids are back in schools, where our small businesses are operating, and where our doctors and nurses have more of a realistic work-life balance. So Dr. Fauci of the Coronavirus Task Force actually says that the skepticism around these vaccinations has come down quite a bit with the messaging that's been happening over the last several weeks with the partnership with the private sector, and that there's an expectation that we can reach 70% levels of vaccination, which would be very positive. So I think the best idea here is we want to build confidence in the system. And we are going to begin with people that are going to be standing in line, rolling their sleeves up, saying, I will take this vaccination, because they're the ones that are caring and comforting the folks that are infected. But it will be very much a public service announcement, public education, public engagement priority, and it's going to happen across the country and around the world.
So let's go to one of our Zoom participants, Peter Seymour from KTAR.
Thank you. Good afternoon again, Governor, and thank you, CJ. So let's further on a little bit on testing now. It's free to Phoenix residents at the airport, limited days, but how do we encourage people out of town to go get tested? Yes, it might be at a cost. You talk about promotions of public relations campaigns and so forth. How do we get people who are landing here to get tested and make sure that they can, take it upon themselves to quarantine and not spread the virus if they have it?
Well, thanks for the question. I mean, we're doing everything we can, both at Phoenix Sky Harbor and Tucson International, so that we have testing available and free to visitors and snowbirds that are coming into our state. We've been conducting millions of tests and tens of thousands on a daily basis. Testing is plentiful. It is likely the best thing that people can do beyond the simple mitigation steps that we're offering in terms of wearing a mask and socially distancing. So we're going to continue to advocate and have public service around testing, put dollars behind it, expand the number of testing sites available. But people have been taking advantage of it, especially as you see the case count rise. That is because we are doing more tests and positivity has been rising.
Let's go to Jennifer with Fox 10 with a question about large events.
So you're focusing on public events, but what about private events? We're talking about funerals, holiday parties, weddings, that sometimes they don't have social distancing. They're family members, they trust each other, they may be asymptomatic. You guys have said that this is a big super spreader, so why just focus on public events? What about those private events as well?
Well, we think, Jennifer, I think it's a good question. And I think as somebody who is the chief executive of the state's government, we have authority over public events. So we can put out that guidance. But the same common sense that applies to a public event applies to a private event. So this idea is, I believe that Arizonans are smart, and given the facts of how they can protect themselves and their loved ones, by and large, they will do that. And we're going to continue to communicate that. And if you've been a regular observer of these press conferences, you know that you've heard this time and again. And by and large, Arizonans have been great.
But that the numbers aren't showing that common sense because they just keep rising.
The numbers are rising across the country, everywhere in the country.
Let's go to JJ.
Governor, changing the subject a little bit, was it the president that called you during the certification on Monday? Have you spoken with him about Arizona's election results? Did he ask you at any point not to sign the certification?
So it was the White House calling during the election results.
Who at the White House?
Well, you don't know, because any call that comes out from the White House is through a switchboard. So I was at a public ceremony doing an official act. So regardless of who was calling, I was not going to answer the phone at that moment. But immediately thereafter, after the event, I called back to the White House, and it was the president.
And what did you and the president discuss?
Well, I keep my conversations with the president in confidence, and I'm going to continue to keep that policy.
Did he ask you to not certify the election?
I said that I'm going to keep the conversation in confidence, but I think it's important that I answer that question directly, and the answer is no.
What topics were discussed?
Let's go to Bianca.
The president is got an inquisitive mind, and when he calls, he's always got a lot of questions, and I give him honest answers, direct feedback, and my opinion when it's necessary. And that's all I'm going to say on the
What would
topic.
you say to him and the people who say that Arizona's election result was fraudulent and should not have been certified?
So your question is, what would I say to the people that are?
Believe the election result.
Well, the first thing I would say is it begins at the county level. In Arizona, all 15 of our counties have certified the election. Maricopa County, Pima County, Mojave County, Coconino County. These are red counties, blue counties, and counties that are in between. After those 15 counties certify the election, by state law, 4 weeks after the election on the first Monday, the state certifies the election. What that date and action triggers is an opening for any potential legal action. And there is legal action right now challenging these results in our state court. I think Judge Warner said he is going to err on the side of allowing more versus less discovery because the judge believes that the case will be elevated to the state Supreme Court. So this is the process. The clock is ticking. If you have a claim or an irregularity or any proof, this is the time to bring it forward. No due process will be denied. That's what I would tell people.
Thanks, Governor. I have two questions. The first is you've announced today that $60 million are going to be provided for additional staffing. Where is that staffing going to come from?
I'm going to ask Dr. Chris to help with this because she's been the one that's reached out and found the professionals.
So this is the same contract that we had during the summer for the summer staffing initiative. So we work with Vizient, who is a staffing resource, a company who gets nurses from all over the country. So they can come from anywhere. We've asked them not to come from Arizona.
But if other states are also also in crisis, how do you ensure that there's an appropriate staffing level that's reserved for Arizona?
So what we understand is that they are prioritizing the largest orders, of which Arizona is one of those. And so they have guaranteed that they believe, based on the prices and the contract that we have, that they can provide us with the 500 nurses before the end of the year.
My second question is for you, Governor. You've said that by and large Arizonans are doing well in following the mitigation efforts. I think you, if I understood correctly, said around 90% are wearing masks. Yet we still see our numbers at dangerous levels. Doesn't that mean that more mitigation efforts need to be put into effect in order to bring those numbers down?
The virus is spreading. It's spreading everywhere across the country. We have put additional mitigation steps forward, but we are in for a tough several weeks here. And that's why we want to be prepared. We don't want people to have to go to the hospital. You can avoid catching this virus. Now, sometimes you can be as cautious as you like, and because of how contagious it is, you can still catch it. But we're going to keep talking about the mitigation steps that work, how we got out of the challenge that we were in late June and early July, and we're going to continue to focus on that.
But over the summer, weren't more closures announced? Bars, indoor gyms, restaurant capacity, weren't those steps announced which helped slow the spread in the summer?
That did help slow the spread. Those steps are still in place with the guidelines adjusted and places of large gathering. And that's so much of what this has been about is breaking up the large gatherings. If you remember back in the spring, it began with spring training and baseball season and concerts, et cetera. None of that stuff has come back to date, and in places like nightclubs and bars, unless they've converted to restaurants with the limited capacity, they're not open.
Okay, let's go to Alejandro.
Governor, thank you. Many health experts are in favor of a statewide shutdown to prevent a catastrophe because of the virus. Banner Health today reported a 120% increase in emergency room visits in the month of November. Could we see a shutdown later on down the road if numbers continue to climb?
Well, I just want to say, and I'm listening. I hear those requests, and I hear the very loud calls from folks yelling lockdown. And I just don't think it's the right policy. I think that we have put aggressive mitigation out there. We know that we can slow the spread. But when you say the word lockdown, you're talking about shutting down entire industries, closing classrooms, bankrupting small businesses. You're talking about putting hundreds of thousands of people out of work. And when we had the first stay home, stay healthy, stay connected order, that was in alignment with the entire nation that had 30 days to slow the spread. And at the time, we had plussed up unemployment. We had small business loans. We had PPP loans. We had protection so people wouldn't lose their place to live. So no, I don't think the right answer is to throw hundreds of thousands of Arizonans out of work before the holidays to slow this spread, because I don't think it would slow the spread. I think if we'll pay attention to the mitigation steps that we have, and there would be some partnership on accountability with local municipalities, we'd see a lot better result.
Let's go to, okay, go to Dylan.
Hi, Governor. I have a question about the new measures, and then I have another question about the vaccine.
Yes.
Have you seen any forecasts for the effect that these new measures will do in decreasing the amount of cases that we're seeing every week?
Well, I can only speak, there's all kinds of models out there. And of course, we look at Department of Health and then what IHME and COVID Act Now and COVID Exit Strategy, Johns Hopkins, Duke, Harvard. There's plenty of epidemiologists that are on the case. I, of course, listen. to what they have to say, but I would say I focus on what the White House Coronavirus Task Force says, and that's Dr. Robert Redfield, Anthony Fauci, Deborah Birx, along with the other military men and women that are in charge of logistics. And then finally, I have to sit down with Dr. Christ and get her best recommendations. And that's how we're going to continue to do it, is to just take the best possible information, apply it to Arizona, and make sure that we're making the correct decisions for the people in our state.
Is there like a time frame that we can expect to start seeing these numbers start to decline? Because obviously, like we said, like everyone has said, it's not just an Arizona problem, it's across the entire country. So if Arizona can somehow figure to do something right, like obviously that looks really good for how people will be able to follow.
Well, like I said, the different models have different information. When you have my responsibility, you have to plan for worst case scenarios. So we want to be prepared whatever may come. Now, I recall the spring very well, and I recall the summer very well. And I know there's an incredible amount of focus on this pandemic, as there should be right now. But if we put our shoulder to the wheel, if we pay attention to the mitigation steps, if we apply common sense, and we have local accountability and enforcement, that's what we can do to turn the corner on this. And vaccines, I mean, it's almost beyond belief to me from a miraculous standpoint that we're talking about vaccines in Arizona on December 15th. I mean, today is December 2nd. So we're less than 2 weeks away from that moment. Now, we're still going to have some real challenge once they get here, but that will be an inflection point where we truly begin to turn the corner back towards normality, and that will likely be sometime late spring or summer.
So on vaccines, where do you fit in the priority for receiving a vaccine, and will you take one if you're given an option?
Where do I fit in the priority?
Yes.
Well, listen, there's a lot of people that are much more important to fighting this pandemic right now, like our doctors and our nurses. So I don't know that governors fall in line to it, and I would certainly never jump the line to get a vaccine. I want our most vulnerable to get this vaccine first. But I want you to know when it is my turn, or when there is enough availability, I'll have my sleeve rolled up. And Dr. Chris, can you give me this? So I have no concern about getting the vaccine. I will be receiving the vaccine. I won't be jumping the line.
So let's go to one of our patient Zoom participants, Brenna Goff from Bloomberg.
Hi, thank you. I have another question about the vaccine, either for the governor or Dr. Christ. I'm wondering if the state's data system is ready to track who receives the vaccine and how the state will ensure that people receive the second dose.
Thank you. Yes, this is something that we have been working on over the past few months. So we will have a vaccine management system in place when the vaccine gets here that will be able to track and do recall notices, so to ensure that people get that notice for that second dose and remind them what dose that they need.
I just want to speak on that a little bit as well, because Dr. Christ is coming at it from the task force standpoint, and I've been able to observe some of the work that she's done and been on these video teleconferences with the White House task force. And I think it was some of the Navy or Army people that were involved that said this is going to be the greatest logistical undertaking in the United States since World War II. And it's not only vaccinating as many as we can of 320 plus million Americans, but doing it again within the 28-day time frame. So this is something we've been laser focused on and talking to you early in the fall about. It's something we want to excel at in Arizona. Of course, we're sharing best practice and gleaning all the knowledge we can, not only from the federal government, the private sector, and other governors that want to roll this out in the best possible, efficient fashion.
Thank you for taking my question, Governor. There were 3 counties last week, Yavapai, Navajo, and Apache, that they were a substantial spread in all three categories that the state health department monitors. This week, if nothing changes, and it looks like the numbers aren't turning down there, they will be 2 weeks in all three categories. It's a substantial spread. Under the state health department's own recommendations, that means after the 2 weeks that that restaurants can remain open, but that gyms and indoor theaters should close. Will the state be taking more dramatic action or working to take more dramatic action in those counties with the worst spread?
We're going to focus on limiting capacity in these settings. We've put the mitigation strategies forward, and we'd like to see local accountability around them. I mean, that's what we're doing.
Do you have any concern that you are not following the advice of the hospitals, which are treating the patients, and the major researchers, the best researchers in the state, in their recommendations? These are the experts who are begging you to take more dramatic action.
Listen, I have concern every day around this virus, and it is our top priority. But there are other things around public health that we're not talking about today, like suicide attempts, like depression, like emotional and social disconnection, like child abuse, and like domestic violence, that are all part of the suggested lockdowns that are coming from people that are only focused on one item and not the totality of public health. So I am listening to the smartest and best people in the medical profession and making the policy decisions that I believe in my heart are best for all the people of Arizona.
Okay, let's go to Jeremy.
A couple of questions. The first one's real quick. Regarding the vaccinations, you said those will be free of charge to anyone who wants one. Who's going to be paying for that?
We're working with the insurance companies to make that happen. It's not going to be taxpayer dollars.
And the second, as I'm sure you saw, we had a self-styled election fraud hearing the other day in downtown Phoenix. A lot of reported evidence of fraud, and we have a lot of lawmakers.
It was a meeting.
Officially, yes, a meeting. And at this meeting,
Hearings are at the state capitol.
well, we have these 9 lawmakers who are there. They want you to talk about wanting you to call a special session to investigate this for a more official hearing. What's your response to what you heard at this meeting and to these calls for a special session?
Well, first, whatever evidence was presented at the meeting should be taken to the state courthouse, and due process is available. So that's where you press your legal claim, and the legislature will open up on Monday, January 13th.
So you see no need for a special session to look at any of these issues or the issue of presidential electors?
I'll see the legislature in January.
Let's go to Jimmy Jenkins from KJZZ.
Thank you, Governor. The state is constitutionally obligated to provide health care to people incarcerated in state prisons. So why are they among the last of our citizens scheduled to receive a COVID vaccination instead of the first?
Well, first, I don't know that they're among the last. I think that I said we're going to focus on folks that are in congregate settings, and inmates are in a congregate setting.
I'm going off of the latest release from DHS about the different phases. They're in the last phase, and there will be 4.3 million Arizonans ahead of them in line.
Well, I'll work with Department of Health Services to see how we can make certain that we're caring for all Arizonans in the appropriate way.
Can you talk specifically, just please, about your concern and, specifically for your responsibility for the health and well-being of people who are incarcerated in state prisons?
Sure, I think it's our responsibility. We want to make sure that people, when they are serving their time and paying their debt to society, that they can do it in the safest possible way. Of course, prison is a very tough place, and in a global pandemic, it's been an ongoing challenge. But the vaccinations are on the way. We have expectation that we can complete this, of course, sometime next year. I've given the horizons of late spring to early summer, but so much of that is going to be reliant on federal government and the private sector. And we already have steps in place inside our state prisons. So when there is an infection, that someone is removed from the general population and put in a situation where they're either around other folks with COVID or quarantined.
Okay,
Could you bring
go ahead, Jimmy. Okay, so I want to make,
Thank you. Could you bring Director Shin with you to the next press conference? Because I have a lot of more specific questions about the prisons, and I haven't been able to contact him. Would that be possible with the next briefing?
We'll get you together with Director Shin.
so we have time for a few more questions. I want to make sure everyone has the opportunity to ask at least one question. Let's go to Nicole Acevedo, please, on Zoom.
Good afternoon, Governor. Thank you for taking the question. This is Nicole Valdez with ABC 15. You mentioned earlier that this is the time to bring forward any election challenges. You yourself are now named as a defendant in the new challenge trial today by Sidney Powell, calling for the decertification of the results that you and Secretary Hobbs signed off on Monday, echoing some of those claims that you just talked about were shared at the meeting on Monday. What is your response to that? This is the same scenario and evidence that Republican leaders have been pushing, despite really no concrete evidence of any widespread fraud, which is what they're alleging in this latest suit that you are now named in.
Well, let the legal process play out. Let the legal process play out, and if there's something there, let it be discovered.
So no specific response to you being named as a defendant?
Well, normally I don't comment on ongoing litigation, but I know this happened, I think, as I walked into the press conference.
I've got one follow on some of the Trump stuff. When you talked with him on the phone later, did you guys discuss at all the fact that he on Twitter said that you had betrayed Arizona by certifying this election?
My discussion was after the meeting. In fact, Dennis, you were the last member of the media that I saw. If you recall, you wanted to get an interview outside the elevator, and I said, no, I had work to do. I had a priority. And I went back to my office. That discussion was minutes thereafter, and I think what you're describing came hours later.
And real quick, the chairwoman of your Republican Party the other day, too, told you to shut up.
Actually, use the word "shut the hell up," which was the term I asked you if you were going to do for them. She's told you to shut the hell up. What's your response to those people?
Well, I think what I would say is the feeling's mutual to her, and practice what you preach.
And one final thing, too. I just want to be clear. You were asked earlier about forecasts. And do I understand this correctly that we don't know, or you don't know how effective these measures you're announcing today are going to be because they're not based on any scientific forecast that you have right now. Is that correct?
Well, I wouldn't say that's correct, but I would also say that you cannot predict the future with this. Everything is a mitigation strategy to try to slow and contain this virus. I will share with you that in June, when Dr. Christ and I were on a conference call with Dr. Deborah Birx, and she gave us the mitigation steps that we applied, she said that this would be the equivalent to a stay-at-home order. And then if you recall, several weeks later, we were being called a model in terms of how to reduce the surge. Those are the steps that have been adjusted and are in place today. We just need more participation with it, along with accountability.
Okay, folks, thank you very much.
Just real quick, do you believe Tucson's curfew is legal? Do they have that authority? Would other cities, if they want to follow that step, be able to do that under your executive?
I'm going to leave that to the attorneys. I don't, like I said, I don't think it's good policy, and I'm trying to do things that provide good results rather than good intentions. So I want to say again to all Arizonans, thank you for what you're doing. Thank you for your commitment. Please continue to follow these public health guidelines of wearing a mask, socially distancing, washing your hands, and staying home when you're sick. And please, to all the great business owners out there, continue to follow the public health guidelines. It's keeping the public safe. It's keeping your employees and customers safe, and it's allowing us also to keep our economy open. Thanks, everyone. God bless.